We have with us Dr. Rashid, who is the Managing Director of Ummeed Rehab and De-Addiction Center. We are going to talk to him on the subject of de-addiction and its trends. We'd first like to know what motivated you to get into this field and what motivated you to start a rehabilitation and de-addiction center.
I have been involved with healthcare as a volunteer in many NGOs in Bangalore since 2016. So we started seeing this trend of our boys and girls getting addicted to substances who needed to be de-addicted. The what market had to offer de-addiction centers was mainly run by non-Muslims, not catering to the unique needs of Muslims. I had an opportunity to collaborate with one such center being run in Kaglipura. And since I was anyway volunteering with NGOs, I went there and helped them become professional in running the center. I don't want to name the center, but they are doing a good job.
So, what type of addiction do you primarily focus on in this Ummeed Rehab and De-Addiction Center?
See, we focus on all kinds of addictions, including behavioral addictions like gambling, internet addictions, and substance abuse like injection drug use, ganja, cigarettes, and alcohol. All the main types of addictions we cater to.
So, sir, are there any specific treatments or approaches that your center follows to guide these people out of addiction?
We follow a modified Minnesota model where we put this gentleman through 12 steps of Alcoholics Anonymous, and we have added a touch of Islam to it. Usually whenever this person comes in, we detox him for first few weeks, and then he enters this 2.5 months of rehab.
Could you elaborate more on the Islamic touch that you mentioned?
The most important aspect of our de-addiction is compassion. We show compassion. We don't beat our patients. We embrace them. Then we also regularly do ruqya. And we also have these special counselors who try to understand why did they fall into addiction in the first place.
In your experience, what are the main challenges these individuals face while in the process of recovery?
See, once they stop whatever substance they were taking, for example, one of the latest drug they are addicted to is Tidal, which is a narcotic. It is like morphine, and its detox is extremely difficult. Their craving goes up significantly. They have very high difficulty coping with day-to-day activities. So during this detox, if we handle this detox properly, then they can enter our rehab program and come out successfully.
Can you tell us about the recent trends in the field of de-addiction?
A lot of research is going on where they are trying to develop vaccines so that these individuals who are addicted can come out of it easier. And people who are not addicted, even if they try a substance, they may not get addicted at all. They may never get that kick.
So, among all the treatments that are already there, do you think there is anything that should be added?
See, unfortunately, majority of de-addiction centers are not run by professionals. It's like a big hall where people are dumped like sheep. We don't have to reinvent the wheel. Just be compassionate, show your human side, and recovery follows.
We were talking to Dr. Rashid, who is the Managing Director of Ummeed Rehab and De-Addiction Center. Thank you. This is Alia Amreen for Karnataka Muslims.